One, and you may start now.
Good morning, everyone. Thanks for taking time off to attend this virtual event on this sunny Sunday morning to people in India and good evening to others across the world. Living Longer with Diabetes is organized by SIMA in association with USV and supported by Dr. Mohan's Diabetes Specialty Center. SIMA is South India Mice Association, and our objective is to be South India's leading association to effectively promote and manage mice, which is meetings, incentives, conferences, and exhibitions with highest levels of integrity and transparency as a non-profit venture to promote the region. SIMA works closely with various stakeholders, governments, and associations to help transform the South Indian mice industry. It's my pleasant duty today to introduce my good friend Sri Rajdeep Sardeshai, who is the moderator for this digital diabetes conclave. Rajdeep Sardeshai is an award-winning senior journalist, author, and TV news presenter. Rajdeep is a graduate of St. Xavier's College and has done his master's and LLB from Oxford University. He is currently the consulting editor and lead news anchor of the India Today group and has over 3 decades of journalistic experience in print and television media. Radib has won more than 50 awards for journalistic excellence, including the prestigious Padma Shri for journalism in 2008 and is the first Indian to win the Asian Television Award for both talk show and news presentation. He has been the news anchor of the year at the Indian Television Academy a record 10 times. Rajdeep has his own blog site and is the third most followed journalist in the world on social media site Twitter.
Wow.
As of today, he has, hold your breath, 9.1 million followers on Twitter. I sign off the name his wife Sagarika Ghosh has given coin for him as the Walter Cronkite of Indian TV. So I would now request Dr. Mahesh Abhyankar, Vice President from USV, to introduce the eminent panel of doctors for today's diabetes conclave. And after the introductions, Rajdeep Sardeshai would immediately take over to start the sessions. Over to you, Dr. Mahesh.
Good morning to all the viewers. I think India is the epicenter of diabetes. We Indians are prone to develop diabetes, and the changing lifestyle, obesity, eating patterns, lack of exercise are adding fuel to this particular diabetes problem. Now, when somebody develops diabetes in the 30s and 40s, he is going to stay longer. So what is the secret of staying longer? That will be discussed, because the advancement in the medicine as well as healthcare has definitely given that particular clue. USV as a company is leader in oral anti-diabetic drugs, and one of the best medicine for diabetes is metformin, and we are the leaders of metformin in the world. We believe in patient-centered approach. Almost 10,000 medical camps we conduct across India to screen the people suffering from diabetes or those who are prone to diabetes. We run a national diabetes educator program, and in the last 10 years, we have created 13,000 diabetic educators, which are helping the patients. And we do a lot of Facebook Live NDTV activity. In the last 6 months, we have got 10 million viewers for our awareness campaign programs. And we also do a lot of educational programs to upskill doctors. Today, we have got 3 experts with us of international repute. Dr. Amrish Mittal, who is the chairman and head of endocrinology and diabetes, Max Healthcare Group, New Delhi. He's also a board member for International Osteoporosis Foundation, and is a founder and chief advisor of Indian Society of Bone and Mineral Research. He's a great clinician. He has won so many awards. Some of the important awards are Padma Bhushan, BC Rai Award, and apart from that, Laureate Award from Endocrine Society of US for International Excellence. And he is the only Indian to get this particular award. We also have Dr. Mala Dharamlingam. She is a professor and head of the Department of Endocrinology, Diabetes and Metabolism, Ramaya Medical College, Bangalore. She is an excellent speaker at various national as well as international forums. More than 134 research publications. She also has got awards, BC Roy Award as well as Academic Excellence Award. And she has got so much of vast clinical experience, and her patient-focused approach makes a great expert in the field of diabetes and endocrinology. We also have Dr. V. Mohan, who is the chairman and chief of diabetology at Dr. Mohan's Diabetes Specialty Center, Chennai. And there are 48 diabetes centers, and almost 5 lakh patients are registered under this particular banner. He is also president and director for Madras Diabetes Research Foundation. And over his career, almost he has published more than thousands, so almost it is touching 1,300 research papers. So it's a great research experience. And because of that, he is also awarded from ICMR for his research. He has got almost 180 awards in his career. He also received Padma Shri, BC Roy Award, and the American Diabetic Association also awarded him for Dr. Harold Riffin Award. And very important is that now he is coming out with autobiography and the Making Excellence a Habit. I think that will also tell a lot about that. So over to Rajdeep for taking this particular session ahead. Thank you.
Thank you very, very much, Dr. Abhyankar there. And it is indeed a pleasure this Sunday morning to be here at this Diabetes Conclave. Let me just throw some facts because I think it's important to separate the facts from the fake news in the world that we exist. And I think it's important not so much to shock people, but to inform people with some hard facts. In 2020, India has an estimated 77 million people with diabetes, which makes it the second most affected country in the world after China. So that's fact number one. Fact number two, according to the International Diabetes Federation, 463 million people have diabetes in the world, and 88 million people have it in the Southeast Asia region. Of this, 88 million people, 77 million belong to India. 1 in 6 people in the world with diabetes is from India. That's about 17%. And the number of people with diabetes in India is projected to grow to 134 million by 2045. As I said, we are throwing these numbers at you, not so much to shock you, but to inform you. And I think one of the good things that has happened in the last 12 months as a result, if it can be called a positive from the coronavirus pandemic, is that it has focused public attention in a way on issues of public health in a manner like never before. So I think it's important that the timing of this diabetes conclave will, in a sense, perhaps increase the information that people need to be provided about why they need to be conscious about the challenges that lie ahead and what the medical fraternity is doing to ensure that diabetes is brought under control. Hopefully, we haven't sounded an alarm bell. Hopefully, we've sounded simply a warning, which will eventually result in people living a longer life. I think that's the theme today, living longer with diabetes. And we have 3 of the country's top doctors, Dr. V. Mohan, Dr. Mala Dharmalingam, and Dr. Ambrish Mittal, who were just introduced, to join us. And we're going to ask them the questions. And remember, you, the viewer who's listening in, can also send in your questions right through. This will be an opportunity for you also to raise your questions, which the doctors will answer. Let's start, therefore, with Dr. V. Mohan. Dr. Mohan, the theme today is living longer with diabetes. And maybe let's start with the issue of early detection, because how long can diabetes patients live is a question that's often asked. How long can I live with diabetes? Why don't you take the floor, Dr. V. Mohan, and kick off today's conclave?
Thank you, Mr. Ajit Sardesai. I'm so happy to see that the person of your eminence is actually moderating this very important conclave. and you very rightly thrown out the figures on diabetes. And if at all, I would say, and I'm sure my two panelists will agree with me, that these numbers are probably underestimates, and they're probably going to be much, much larger than those numbers that you mentioned. Now, coming to the question of how long can diabetic patients live, it's very relevant because we have a lot of statistics over the last many years, both from India as well as from almost all the developed countries, showing that diabetes shaves off so many years from your life. You know that in India already our life expectancy is only 68 years for men and 70 years for women. And of that, it's estimated that about 7 to 8 years of life you lose if you have type 2 diabetes, which is a common form of diabetes that we all have in adults. And if you have type 1 diabetes, up to 15 or 20 years of your life can be cut short. So this is what we have been taught as students. And in fact, one of my teachers used to very elegantly teach me that the duration of diabetes, suppose you're 40 years old and you have 20 years of diabetes, your arteries are actually 60 years old. So biological aging is different from chronological aging. So with all this, gloomy picture, you would think, oh, people with diabetes then cannot live long. That's when I started following up many of my patients, and I found that on the other end of the spectrum, there are people who have lived 40 years, 50 years, 60 years, and even 70 years with diabetes. So I published that paper, and that's what got me that Harold Rifkin Award. Subsequently, then people said that's only duration. You're still not talked about the age and the life expectancy. So a few months ago, I published another paper on people with diabetes who are about 90 years of age, and some of them actually crossed 100 years of age. So I thought that was a landmark achievement. Here is a country where even without diabetes, your lifespan is only 68 and 70 for men and women respectively. And we're talking people with diabetes who lived up to 100 years. Now you may say maybe they just got the diabetes when they're 99 years old, and that's why they crossed to 100 years. No, they've lived for 60 years with diabetes. So if my teacher was correct, then the man who's crossed 100 years of age and had 60 years of diabetes is actually 160 years old. So I mean, this is astounding, So I thought that this fact also has to be told, that while on one side we are depressing people by saying that it may cut short your life, on the other side we are saying you can actually live long, and both are correct. So in essence, I think what this conclave should discuss and will discuss, I'm sure, is how to make everybody in India live up to 100 years, and not just live up to 100 years, but live in good health. And that's been for the World Diabetes Day on November 14, 2020. I put out a kind of slogan saying that my ultimate vision is to see that people in India will have a diabetes-free, complications-free life. That means even if they have diabetes, nobody in India should develop the dreaded complications of diabetes. We're able to achieve that, and I think it's eminently achievable, and we'll discuss how to do that. I don't think people with diabetes should actually talk about living less than people without diabetes. In fact, I would go as far as to say that they should live longer than people with diabetes because they're taking of their health, care of their health so well. So I'll stop there. Thank you.
Interesting. So you've offered a positive, you reflected a positive spirit, and it's always good to have that right at the very outset, because sometimes otherwise people sort of get very, very anxious about, what lies ahead for diabetes patients. But as you pointed out, the possibilities are enormous to live a healthy life while conquering or living in a way with diabetes. But Dr. Mala Dharmalingam, what are the common risk factors in a way for diabetes, and how important, therefore, is it for early detection in a way to mitigate these risk factors in the context of the community in particular?
Thanks, Rajri, for the question. And I'll take it a step further than Mohan and say that you can actually prevent diabetes. Why to live long with diabetes if I can make an attempt not to get diabetes itself? So that is why it's very important that we recognize these risk factors. These are very common risk factors. And if someone was aware that if you could prevent or manage these risk factors, you can actually prevent diabetes itself. So there are the common ones are weight. In India or in the South Asian countries, our weight should not be more than what we call a basal body mass index of 23. It should not, our body mass index should not be more than 23, which is weight by height. The distribution of fat If you see Indians, we are not very obese people, but our fat distribution is around the abdomen area, which we call visceral fat. So that is again a risk factor. Family history. If you have parents or someone in the family, may not be parents, even grandparents who are diabetic, it's time that we took care, saying, okay, now I know I have a predilection, let me do something about it. Indians, by and large, are more prone. So the race itself and the ethnicity itself is a risk factor. Then, of course, as you age, the chances are more that you become diabetic. All over the world, globally, people become diabetic after 50. We in India become after 40 years itself. So we are at higher risk at a younger age. Then we have inactivity, physical activity. So I think I'll take this opportunity for me to tell people that it's very important to be physically active. And today we say sitting is equal to smoking. So people should just move around as much as possible. Some things like snoring, which we call obstructive sleep apnea, is again a risk for getting diabetes. Suboptimal diet, Dr. Mohan has written very nicely about this in his paper. But you see, if your diet is not balanced, if I ask someone, what is your food? He'll say, I don't eat anything. I eat only rice and chapati. That is not good enough. That is just carbohydrate. We have to start making people understand they need to have protein. They need to have lots of fruits and vegetables. There is so much taboo in the mind of the people, or let's say myth in the mind of people that diabetes should not eat fruit, they should not eat this and that. There's nothing like that. There's nothing like a diabetic diet. It's just a very healthy diet that you and I, even if we are not diabetic, should consume. So these are some of the risk factors. And because of these risk factors, there are associations with blood pressure and so other risk factors. I would also like to say that in girls, this is something that I very closely am attached to. Girls of adolescent period put on weight and get something which is called polycystic ovarian syndrome. And with irregular cycles. And this is again an area which is a preventable cause of progressing into diabetes. And of course, I should not forget to mention gestational diabetes, again, a risk to becoming diabetic later. These can all be graded, scored, and you know your risk. But just to remember that all of this, you can actually prevent progression to becoming diabetes or even pre-diabetes for that matter of fact. Thank you.
Very interesting, Dr. Dharmalingam. You're almost tempting me to get up from my chair and go out and walk. As you say, sitting is equivalent to smoking. And I think that's a sort of one line that will stay with a lot of people. We'll expand on some of the points that you made, particularly about dietary habits in a moment, and you know, whether an indolent lifestyle is part of the problem. We'll look at lifestyle habits in a moment and their impact on diabetes. But Dr. Mittal, you know, the question is, what is the level of awareness about these lifestyle disorders in the people at large? As someone, you know, who's been in the field for years, do you see that the awareness has increased, or do people sort of, or have lifestyle disorders actually intensified, given the fact that people now perhaps have a lot more time at occasionally to spend, a lot more money to spend on leisure?
Well, thank you, Rajdeep. It's a pleasure to be here. And of course, you know, many years ago, Elliot Jocelyn said that diabetic who knows most lives the longest. Right. So it's a condition where it's not like malaria or typhoid. You go to the hospital, they treat you and you're okay. It's something you have to live with. So it's very, very important that self-management, you know, what we say is that what is the goal of the doctor in this whole story? The goal of the doctor is to empower the patient to look after himself or herself. And I think that is the point that sometimes is forgotten. We treat it like a disease where we prescribe medication. We really need to empower our patient. And that empowerment starts first with awareness about the disease. So let me give you some facts here. Roughly 50% of people don't know they have diabetes, although they have it. So if you were to find 20 people in your colony who knew they are diabetic, they will be who have diabetes. Maybe another 20 will have diabetes and not know it. You know, we saw that during the COVID pandemic. We'll come to that later. Admitted to the hospital with COVID, severe COVID, didn't know you had diabetes, and sugars are shooting to 300, 400, and then HbA1c, that 3-month average, is very high. So what I'm saying is lack of awareness means people don't know that they have diabetes. And the fundamental truth there is that you will not know that you have diabetes unless you check your blood glucose. So if you depend on symptoms to diagnose diabetes, you will always be floundering. So I'll come back to that. But if you look at hard data again, in 2014 study, ICMR study, and Dr. Mohan was involved in that, 43% of people had sort of heard about diabetes. 43% in 16,000 sample of 16,000 people, 11,000 rural, primarily rural study, 5,000 urban, and only 36% people in rural areas were aware about diabetes as a word. That's how it is. And this also, again, India is not one India. There are many Indias within India. There's rural, there's urban, and then there are different levels of economic development in different states. So the awareness, let's say, in an economically backward, relatively backward place, which is still growing rapidly, like Jharkhand, versus a place like Chandigarh or Maharashtra, was very different. It's proven in a study. So the awareness also depends on your level of economic development, although diabetes also increases with the level of economic development, but that's the other part. On the other hand, when you look at cities like Delhi or Chennai, where people are coming for care, and there you find level of awareness of diabetes has increased exponentially. There is no question about that. From when we started our careers, all three of us, to now, there is a big difference in the level of awareness. Diabetes is a common word. Sugar is a common word. Everyone knows sugar, even if they don't know diabetes. The important part here, however, is that, diabetes is not just blood glucose. Sometimes the sugar thing has become so ingrained in our minds that we think it's a blood glucose and it's related to eating sugar. And I think we forget that it is just an index. It's like a marker of many things. So if someone has a high blood glucose or has diabetes, that person is more likely to have hypertension, cholesterol problems, heart disease, and even, God forbid, even cancer. So what I'm saying is that the glucose itself is just one marker. It's a way to stratify or classify a person as being at greater risk for complications, and not just look at the glucose part of it. It's a much more holistic understanding as compared to 25 years ago. The key point here again is the lack of symptoms, which people don't know. Therefore, screening programs or testing for people, especially in countries like India, where age of onset is now 30 very often, 25, 20, even younger, even teenagers are getting type 2 diabetes, which is the adult type of diabetes. Screening is very important in those who are overweight or those who have family history and all the risk factors that Amala was pointing out. It's very, very important that they check their blood glucose at periodic intervals. You cannot wait for problems to happen and then figure out. And therefore, sometimes people say that, as endocrinologists, diabetologists, all you guys do is look at numbers. And actually, it is about numbers. It is not about how you feel. The feeling thing happens much later. When your vision goes or your swelling happens or breathlessness happens, it is about numbers. So controlling diabetes, and I think Mohan will expand on that in a subsequent this thing about different aspects of diabetes, blood pressure, cholesterol, the whole thing. So I think it's very, very important that we recognize, we continue to spread awareness about diabetes. I would say a lot of effort has gone in from doctors, even from government, from industry. It has helped people make people more aware. But I do think a lot more needs to go down, and especially with regard to the lack of symptoms and the complications that can happen, and the importance of testing for diabetes. So awareness for diabetes will continue, and the drive, the need for awareness will be there for a long, long time. I don't think we can ever be fully aware. We have made some progress, but we are a long way off from a desirable level. So if you look at India, for example, it's not at all unusual. Every single day, if you in your clinic, in your hospital, you will find people who just went for a health check. In a corporate environment, media environment, very common. In IT environment, young people who just have started their jobs and are sitting and working odd hours, eating at odd hours, ordering food from outside in the office, and very quickly they develop central fat and they develop diabetes. And if they undergo a health check, they suddenly find that the sugars are 300 or 400. So I think awareness is the key. Awareness is the key to successful tackling of this problem.
And you're saying awareness and testing. Presumably,
Yes.
you're calling for an annual checkup effectively.
Yes. Yes, yes. And you will find all these people that these health checkups are useless. They're a waste. They're this, they're that. It's all a money spinning game. You'll hear all those things. But the truth is that if you don't check your blood glucose, if you don't check your blood pressure, you will never know what you have. And you will find out only when you're actually getting complications. And before I give it back to you, I'll just throw in one line here, which is not relevant to your question, but just to complete what Mala was saying, that is the Pomodoro technique of about sitting. When you sit for every 30 minutes, you should get up for 3 to 4 minutes or even 5 minutes. I can't do it for 5, but I try to do it for 2. At least we have to, all of us are sitting in the pandemic, we are sitting even more. Every 30 minutes, go to the window, go to your neighbor, the neighboring room, do something else, take it away. Take your mind and body away from your desk. I think that's very, very important, Mala. If you agree with that, then sorry to divert the the discussion.
I think you've given, both of you have given us here, all of you have given us very important tips early this Sunday morning. That even when you're sitting for 30 minutes, please get up and at least spend 3 minutes moving around. But we'll come to specific specific tips that you have for potential diabetes statement. Let's come to from early detection to effective management. Dr. Dharmalingam, if an individual has diabetes, what are the approaches that can help maintain the target glucose levels? What would you suggest? Is it oral drugs and or insulin? What would you suggest?
So very, very important question, because many people do require to know what I should do. First, they should know what is their target. Of course, with age and with other comorbidities, we may change the target, but by and large, your fasting plasma glucose should be between 100 and 120, and after food should be better to be between 140, 160. Some books say 180, but I usually keep it around 160. Slightly older people, you can keep it higher. Now that you know that this is your target, and with this, you can prevent all complications that Dr. Mohan was talking about. If I can prevent an admission, a hospitalization for a heart disease or a kidney disease, that is all I'm asking the patient to do. And that is the only evidence we have, that if you keep your blood glucose good, you will prevent complications. So how do I do that? We've talked about lifestyle, which is the diet and exercise. We'll go more deeper into that later. But since you asked me about oral medication, we have a large number of drugs now available to us. The mechanism by which the blood glucose goes high are manifold. Earlier, we used to know of only 3 important ones, like insulin resistance, insulin sensitivity, or the beta cell secretion. But now we know that a few years back, we knew there were 8, and now they're almost 12. So looking at each of these pathophysiological mechanisms, there is a drug. I said insulin resistance, which means that it doesn't work well. So you have the basic drug from there, which is the metformin. And then, of course, we have insulin secretion, we have sulfonylureas. Now the newer mechanism, which we call incretin mechanism, we have GLP-1 and DPP-4 inhibitors. And then we now know the kidney is an important aspect. And now studies have been done even in non-diabetics. These drugs which were developed for diabetes seem to be protecting heart and kidneys also. So we have something called SGLT2 inhibitors, which are all in the pathophysiological mechanism, safe drugs used carefully to get you to target. But finally, at the end of the day, you have to have, and of course in Indians, I forgot, the carbohydrate load is so much that we have something called alpha glucosidase inhibitors, which prevent all the absorption of carbs at a one go. They do it very systematically and slowly so that your sugars don't go up suddenly. And then we have the fuel, that is what we say is the insulin, which is actually the hormone that is secreted from the body. These all work in indirect ways, but insulin works as the hormone that is secreted from the body to control the blood glucose. So we have different types of insulin. They are all indigenously prepared, which we call human insulin. And then we have analog insulins, which finally we are trying to replicate what God did. The way he made the short-acting insulins or the insulin secretion in the body, we are trying to get there, though we are a little bit behind God still, but we'll reach there sometime, I'm sure.
I'm sure we will. The big challenge, of course, Dr. Mohan, that, when one talks to people anecdotally, is whether, how do I control blood sugar, A, and is controlling blood sugar sufficient? Is it enough for me to ensure that I've controlled my blood sugar to, in a way, prevent or control diabetes? And if not, what are the other factors that need to be controlled? The focus seems so much on blood sugar that we sort of seem to ignore that there could be other factors that need to be controlled, Dr. Mohan.
You're absolutely right. And I mentioned earlier when I spoke that, my vision is to have a diabetes complications free India. And I think Dr. Amrish Mittal also mentioned about the small blood vessels of the body and the large blood vessels of the body. So we can actually divide these diabetic complications into two. And the whole aim of treatment of diabetes is to have a long and healthy life without any complication. That's why we're treating diabetes in the first place. So these small blood vessels affect the eye, the kidney, and the nerves of the feet. Now, these three, believe it or not, can be prevented just by glucose control. So if your whole aim is only to prevent these three complications, eye, kidney, and nerves only I want to control, then just glucose control itself, you bring that HbA1c test, that magic figure of below 7%. This is a 3 months control test. The normal value is about 5.6. But for people with diabetes up to 7, we give a concession and say it's okay up to 7, because that 7 is derived after many, many years of studies, different studies. They all came to the same point. You keep the A1C below 7, you will not get eye, kidney, nerve complications of diabetes. That is kind of settled. But even in those studies, they could not prevent heart attacks, and they could not prevent strokes, and they could not prevent peripheral vascular disease leading to amputations and gangrene. And so then they started researching and said, oh, this is not enough. If you want to prevent the large blood vessels, which affect the brain, the heart, and the peripheral nerves, then you have to do some more things. And that's how the ABCD mantra was developed. So what is ABCD mantra? The ABCD mantra, A stands for A1C, which is glucose control. So you tick the A box, then your 3 complications are already covered. But to prevent the other complications, you need to tick the B, C, and the D. So what is B? B is blood pressure. So if your blood pressure is below 140 by 90, of course, it can vary with age, but a rough thumb rule is that 140 by 90 or below, your BP box is ticked. C stands for cholesterol, and for that we are referring to the LDL cholesterol, or the bad cholesterol, and that should be below 100 milligrams per deciliter. So if you can tick that box, then you come to D. D actually stands for discipline. So that includes a lot of things. It includes diet, it includes exercise, which we talked about earlier in our first section. But it also includes things like not smoking, because you do all that and then you smoke, then you're going to kill all the arteries with your smoking. And also moderation in alcohol. We're not saying totally not even a drop of alcohol, but there should be a moderation alcohol as well. So this A, B, C, and then of course you should also include stress reduction, which includes pranayama, meditation, or yoga also brought in, because you have so much of stress that will produce heart attacks and produce. So this under D, we bundle the diet, exercise, stress reduction, and of course good habits like avoiding tobacco in any form, smoking or chewing tobacco, and alcohol reduction. So it's a whole lifestyle change is brought under D. So if you tick all the 4 boxes, the A, the B, the C, and the D, it's my belief, it's our own evidence that we have, and there are studies like the Steno study and our own follow-up studies that have shown that you can actually prevent all the complications. If you prevent the eye, the kidney, the heart, the nerves, the brain, and every other complication, then people are going to live longer. So we're going back to the first question you asked me about how long can people live. That's why I believe that people can live up to 100 years of age in good health if they tick all these boxes. So we must make sure that when you go to it's a very valid point you ask, because when people come to us and then we say, we also want to look at your feet and we look at your eyes, then very often people say, but I came to you for glucose control. Yes, you came to me for glucose control, but diabetes is not glucose control alone. It's a whole syndrome of so many things involved. As I think Dr. Mittal said earlier, glucose is only a marker. It's one marker in the blood that we are seeing, an easy marker. That doesn't mean it's the only thing. So if you get all these under control, I believe then the treatment is holistic, and that's what we call as total diabetes care.
I just want to ask a follow-up to you, Dr. Mohan, and this is personal because I have my cholesterol has for a long time been my big Achilles heel. Is there any specific treatment you recommend to controlling cholesterol? A, B, C, D, do they have different needs in a way? Whether I have to control blood sugar, cholesterol, and indeed my diet, do they all require a different kind of treatment? So how do I control C?
C. So for C, of course, you with diet and by reduction in the total fat intake, especially the saturated fats and the trans fats, when you reduce them and when you exercise, to some extent the cholesterol will come down. But a lot of the cholesterol is synthesized internally in the liver. So the liver is continuously, one switch is turned on and it continuously produces the liver. So that's where drugs like the statins come in. Now, statins have been around for now 30 years or so. At least about 50 different trials have shown that the statins make you live longer. Now, unfortunately, the last few years in social media, statins have been made to become a big villain. And not only the statin, the cholesterol theory itself is being debunked, saying there's nothing like cholesterol. There's nothing like LDL cholesterol. It's all made up by pharma and so on. I think that's a great thing that disrespect that we are doing to all the science which has gone behind this. And also when people have stopped their statins, there are studies to show that heart attacks increase and all the good that we did came back. Statins are so simple. You just take one tablet at night and that's it. Your cholesterol will not come down. Even if you go and eat something wrong, still your cholesterol doesn't go up. I'm not saying you should do that, but that's the truth. Whereas in diabetes, it's not like that. You can be very strict with the diet, take all your medicines, still sugar goes up. And the blood pressure also, a little bit stress and your BP goes up. Cholesterol is not like that. It's the easiest to control. You just take those statins and you're done. Your cholesterol, one box is very easily ticked.
Well, I've ticked that box because I do take statins every night. So at least I seem to have got that box.
Keep it up. Don't read the social media.
Okay. Dr. Mittal, accessibility and availability of medicines. You mentioned earlier that awareness is much greater today than it is when you started off in the profession. What about accessibility and availability of medicines? Are they now more accessible, available, more effective today?
Well, effective, of course, as Mala emphasized, when we started out again, sound like an old foggy, but anyway, there were hardly 2 drugs for diabetes, and now there's a plethora of drugs to choose from. So we have a wide array of drugs which all have different actions and could benefit our patients in different ways. Accessibility is a different issue altogether. So let me first say, roughly 80% of Indians pay out of their pocket for their own treatment, chronic care treatment. Now that, if you ask me, is a pretty sad story, because it really should not be like that, because then any impact of drug prices or anything affects the patient directly, who's actually paying for something for which he may have no symptoms at all. You don't have any symptoms for cholesterol, but you have to buy a pill for cholesterol. So you're actually not getting any physical relief, but you're paying out of pocket to prevent long-term complications. So I think there is an issue there. And the important part here is that insurance in our country covers the complications of diabetes. You can get your reimbursement for a transplant, a kidney transplant. You can get reimbursement for a bypass surgery, but you won't get reimbursement for your day-to-day diabetes care or cholesterol medicine. So there is a huge gap. So you're actually allowing patients to go to complications and then we'll pay for your care. But you won't pay for your day-to-day care, which can prevent so much to the exchequer, to society, and to the individual, that you can prevent all these things. As Mala was saying, you prevent one admission, you prevent one bypass surgery, one angioplasty. You won't spend that money in diabetes care for many, many years. So it's important that we realize that. Now, if there are studies in the urban, there are a lot of studies across India, but they're not very good quality studies, let me say, about cost of diabetes care. But there are some studies in urban North India, which is what we generally refer to. And for example, typically, a couple of studies have shown that if you calculate direct and indirect costs, this is 7-8 years ago, it comes to more than 3,000 rupees a month, 3,500 rupees a month for average care in a middle level environment in a city like Delhi. It's usually not less than that, out of which about 16,000 roughly is indirect costs, and 16,000 direct costs, and 26,000 is indirect costs on something or the other. So direct costs meaning what you're paying for your medicine, for your tests, for your consultation, etc. Again, it depends. If another study done by Dr. Singla et al. In Delhi actually showed that if you have less than 5 years of diabetes, the cost of medication, only purely diabetes medication, is roughly 31 rupees a day. This is an urban metro environment. Okay. But if you have more than 20 years of diabetes, the daily cost of medication is more than 130 rupees a day. 130 rupees. So So as diabetes advances, the cost increases. So the case for holding it at an earlier stage is very solid. Both Mohan and Mala have referred to that. If you intervene early, you can prevent all this from happening. Now, therefore, access to cheaper drugs. Now, I think the access to cheaper drugs is now pretty good in India, to be very honest. I think the government also, through their schemes, have very cheap, generic variations of drugs available. There is this whole program in the Ayushman Bharat of wellness centers, which is sort of taking off now. Hopefully, that will provide this, some cover. But remember, like we talk of vaccines, much of the generic drugs that are used in treatment of diabetes are made in India. And no one talks about these things. The basic drug is metformin for diabetes, and more than half of that is made in India, worldwide metformin.
Mhm.
So therefore, you have a choice of generic drugs. Now, newer drugs that are there are more expensive. So I think we will always have to strike a balance. We cannot do away with patents. We should not try to completely dismiss patents. Otherwise, we'll be in the 70s and 80s when no drug reached India for 15 years, 20 years. Okay. Now we get drugs within a year of their launch, sometimes even earlier. So we should respect the patent for the newer, more fancy molecules. And we should ensure that the ones that are there and established actually are really easily available to everybody at a very reasonable cost, which is happening. And Mohan and I wrote a paper on this about the choice of drugs in developing countries. Why do we have to go for all the fancy drugs all the time? Most of us can be helped by our regular basic molecules like metformins, sulfonylureas, and now cheaper gliptins, which are widely available. So, if you're feeling cold, you don't always need a pashmina.
Mm.
It's okay to have a blanket. If you're really dying of cold, what you need is a blanket, right? But to say that, no, why can't I have that one? Because that should also be free. That is, it will never work like that. We have to have stratification in this. The basic essential drugs are quite cheap in India and actually quite accessible. Also, they're not expensive.
Interesting, because cost of healthcare is a major issue at the moment. And Dr. Mohan, taking up from what Dr. Mittal just said, the impact of this cost of healthcare and medicines on living longer. So the sense is that while we the medicines are available now, will they eventually take a toll on an average middle class individual and his desire to live longer?
I think Dr. Amrish has very nicely covered, this point also. I mentioned that I published a paper on people living 50 years and 60 years. Now just think about it. What drug did we have 50 years and 60 years ago? Repeatedly, it's been mentioned by Mala and Amrish that we had only two drugs, metformin and sulfonylurea. Those days, the metformin used to be 50 paisa. And the sulfonylurea also used to be about 50 paisa or 1 rupee. So your total cost of treatment was 2 rupees. What Amrish said is 30 rupees today was only 2 rupees then. These are the people who have now survived 50, 60 years. All the new drugs came in the last 5 years. So where were they when these guys who live for 50, 60 years, they've not even seen or heard of any of these drugs. So it is not, the point I'm trying to say, it's not that the rich who can afford all these costly stuff who live longer, the poorest of the poor can also live. But the ABCD mantra has to be followed. They have to tick the boxes. They have to take their medication. One important point, which even in the ABCD we are not covered, is regularity of follow-up. So when we tell our diabetic patients to come every 3 months, 4 months, there is a thing again going on. Of course, they'll ask you to come every time. He'll get his consultation fee and he's going to get richer. That's why he's going to ask you to come. So we did a study. We did a study of those who came regularly every 3 months and those who didn't come for even once in a year or less than that they came. There was a 50% reduction in kidney disease, eye complication, nerve complication, and heart attacks in those who just came to the clinic. And at that time, when we did the study, all they spent in a year extra for coming those extra 2 visits was 1,500 rupees. So by spending 1,500 rupees here, which is less than our insurance that we take, 50% reduction in the cost of the complication. And just want to end with that, saying that the cost of one dialysis, just one dialysis, is not less than 2,000 rupees, even in a charitable institution. Okay, usually it's much more, 3,000, 4,000, and then you have to do it 3 times a week. So that's 10,000 rupees a month into 4, 40,000 rupees, 10,000 rupees a week, 40,000 rupees a month, 4-5 lakhs a year. Compared to that, 1,500 rupees is what today the inflation maybe 4,000 rupees or 5,000 rupees. So by spending that little bit, this is why we say we are penny wise and pound foolish, because we hesitate to spend that 1,000 rupees to go for a checkup, but we're willing to spend lakhs when our kidney is gone. And at what cost? Your quality of life is completely gone. Imagine undergoing dialysis every time. I'm not saying you can't do it to survive, you have to do it, but you'd rather avoid it, isn't it? Have your own kidney which God gave you, your own feet which God gave you, or rather than trying to put an implant into your eye or your prosthesis and trying to get some bionic limb or something like that. God gave you a much better thing. As Mala said, I don't think we've come near God yet. So we are still far away. So whatever we do, the one nature gave us is still better, and at much lower cost and much better quality of life.
Interesting. The lifestyle factors matter in the Indian context, and many believe that our lifestyles, in a way, have contributed to a large extent for the increase in diabetic patients. Dr. Mittal, your opinion on the concerns of of modifying this lifestyle. All of you, in a way, are talking about diet in particular. Uh, is this a lifetime choice or a life choice that you're asking people to make? And in the process, the diet modifications, what impact do they have?
Thank you, Rajdeep. I think the importance of diet and lifestyle has been brought about, is evident actually by so much data. I mean, a very simple figure I'll give you. When you move from villages to smaller towns, your prevalence of diabetes roughly doubles. When you move from smaller towns to Delhi, Chennai, and Bangalore, it doubles again, roughly. So what I'm saying is the same genes, the people living in villages, when they move to these metros, their risk of diabetes goes up several fold. And a good example in that would be if you did a study on our chauffeurs, our charioteers, our drivers, who often man the middle class and upper. You've read all those books also about that, but about who man are essential part of day-to-day life in larger cities. And most of the people who come, why I chose drivers as an example is because they come from usually from smaller towns. They are physically active, they come here and they're literally in the driver's seat, so therefore their physical activity goes down drastically. And you will find that within 3 or 4 months of their arrival here, their tummy starts sticking out. And most of them will have diabetes. I'm treating so many friends, staff, only I know that. So what I'm saying is that it is quite clearly a lifestyle thing. The problem is that we try to label it as a diabetic diet or a diabetes lifestyle. All it is a healthy diet and a healthy lifestyle. And I think that's very important. What is healthy for a non-diabetic is healthy for a person with diabetes. So, it's a very typical setting. There are two things here. Number one is whenever you try to restrict something, the diagnosis of diabetes conjures up images of lifelong restriction, of being caged, or being trapped. Now I can't do this. All the fun has gone out of my life. And the person just sort of, if nothing, dies of depression, nothing else. So I think this is important to understand, and that's not the case. Healthy choices can be very tasteful and very palatable, and it has to be the whole family, and we'll come back to that later, and the environment that has to change. So it's very often I find that a person, and all of us have experienced this, a person just diagnosed with diabetes is brought to the OPD or comes to the OPD with his family, and everyone sort of descending on that person. That poor chap is being harassed by his spouse, by the children, and everybody saying he does this, he does that, he does that, he does, and everyone's BMI there is 30 plus. The whole family is overweight or obese. And I said, look, all of you have to do the same thing, not just this poor guy. So this whole thing of attaching a name or a stigma to someone with diabetes and saying, no, this guy can't do this guy can't do that, is really a wrong approach. Human nature resists any compulsion, resists restriction. You can see that in the case of masking, for example. People don't like being told what to do. And the kind of people we treat in metros, they're not used to anyone telling them what to do anyway. So the idea is that when we talk of lifelong, we talk of a lifelong health. We talk of lifelong healthy lifestyle, which is the same for your heart, for your kidneys, for your lungs, for your feet, for your brain. So as you were asking, you have to do something separate for the ABCDE. The basis is the same. The drug might differ, but it's not that because of lungs you do something else, because of kidney do something else, because of this you eat something else. By and large, it is a unifying lifestyle, which will healthy lifestyle will protect you, and it cannot be individual based. It
Right.
cannot be individual based. We can discuss that later if you like.
How do fitness and regular exercise impact the lifestyle, Dr. Dharmalingam? Because, as taking off again from what Dr. Mittal said, that a lot of these, a lot of our problems are lifestyle related and critical to, in a way, the lifestyle of the metropolitan Indian is to ensure fitness and regular exercise. I see people much more conscious today of fitness issues than they were even 10, 20 years ago. But is there anything specific that you would like to say on this entire issue of fitness and regular exercise, Dr. Dharmalingam, the amount of time that one should spend? Is it about time, intensity, the kind of fitness regimen that one goes through?
Yes, I will split this question into two and advise or rather suggest what they should do and what the advantages would be. So whenever a physician or a doctor speaks to you about exercise, generally the thing that comes into one's mind is either running or walking, and that's what they think. Yes, what we mean is you walk for, if you say, if I take walking as an exercise, what is recommended is about 150 minutes of brisk walking in a week. But I would go a step further, and why only 150 minutes? Try to make it as long as possible, maybe an hour or two if it's possible, every day of the week. It does lots of positive things to you. A lot of hormones are secreted, feel good hormones are secreted. So in this exercise, we call aerobic exercise. It can be anything of your choice. You want to swim? Go ahead. If you want to play basketball, go ahead. There's nothing like I should walk. Many people say it's so boring to walk. Yes, if you find it boring to walk, do something else that you like, but something brisk. Your heart rate should increase. Generally, we say the heart rate should increase 220 minus your age, at least 70% of that. Try to achieve that, maybe gradually, not in a day, but over time. I also ask our people to do some stretching exercises, or rather toning exercises. Very, very important. Stretching. In fact, many diabetics will have things like frozen shoulder. So regular exercises of all the joints is very, very important. We talk about macrovascular and microvascular complications, but simple mobility is also important. And the third is a little bit of weight training. Very, very important to tone muscles. Indians, by and large, have very poor muscle strength. We don't have good muscle quality. So a little bit of weight training, simple weights, 3 to 5 kilos, can go a long way in muscle strengthening. And I would put all this as exercise, just not the walking or running. It has to be a milieu of all of this. Now, why should I do that? In fact, way back when I was a student, an article had come in NEJM which said that if you can bottle exercise, it will be cost some $1 lakh. So it is something that has so many benefits. It improves the diabetes, it decreases the insulin resistance. It has effects on the bones and muscles. We know we also are very prone for osteoporosis in our country. In fact, earlier it was thought only women used to get osteoporosis. Now we see even men getting osteoporosis at a very early age, actually, in India. So it strengthens bones, it strengthens muscles. Thereby, again, the muscles are strong. They utilize glucose very fast. So your glucose can get well controlled if you have good muscle mass. So that is why we tell them that these are very important. Falls. Very often, now again, we have a lot of vitamin D deficiency. Dr. Amrish is the expert on vitamin D in our country. And that also causes falls. And if you do some exercise training and fitness regimens, you would prevent falls and thereby the fractures and so on and all that goes with that. So apart from that, of course, all of this together increase lifespan. Quality of life. I think this is very important, that you get up in the morning and feel fresh. You should not get up in the morning and say, oh, another day. I think that's something which is miserable. You should get up and say, yes, this is a good day for me every day of the week. And that's something which I strongly believe. And now there's a lot of data on fitness and brain health. I was actually going through, and it's very, very interesting that what all it does to the brain, it prevents depression, prevents anxiety, and all of that. And of course, lastly, what we are here for, it prevents a heart attack, it prevents myocardial infarction, prevents diabetes progression, starting of diabetes as well as the progression. And like Dr. Mittal was saying, even prevents cancers. So I think if people understood the benefits of fitness and exercise, and it is free, there is no cost for it. You should go out and do it. And it's not required that you go to an expensive gym. You can just walk wherever you are, and that would be good enough. Yeah.
You pointed out some of the complications that could emerge. Dr. Mohan, apart from this regular exercise, fitness that was suggested just now by Dr. Dharmalingam, anything specific on how complications can be prevented? It's one thing to prevent diabetes, the other is the complications that could follow.
So, of course, I already mentioned the ABCD, the sugar, blood pressure, and so on. But I would like to also add, because depression was mentioned and mental health was mentioned, I think yoga and pranayama are also very important, because apart from the physical exercise that you get, the de-stressing that we do, because stress is a very important factor both for diabetes as well as for the complications. For example, heart attack. You see in movies, somebody gets a bad news and then he holds his chest. We think they are dramatizing that. It's not, because suddenly some of the hormones kind of go for a 6, and that can suddenly produce a heart attack, a tear in a vessel, an aneurysm can burst. There are so many things, embolisms can go off. So I think stress reduction is also very important. And as I mentioned, take your medicines very regularly. There's a lot of myth around taking medicines. And one point I want to say, everybody will ask me, but people tell me that if I take these medicines, I'll get kidney problems. I didn't train for 50 years and work 50 years to produce kidney problem in you by writing a tablet. Why would I ever do that? Unless I was absolutely sure that there's not even a 0.001% chance of you getting a kidney problem because of my medicine, I will never give it to you in the first place. So I think all these are myths which are propagated by people. Oh, you'll definitely get the thing. The other myth that they talk about is artificial sweeteners and cancer. Some 40 years ago, in some mice experiments, saccharin, one thing was produced bladder cancer in mice. From there, every artificial sweetener will produce cancer in human beings. So I now begin to ask people, show me one case of cancer. Just show me one case of cancer. And in the whole world, if there is one case of cancer, I'm willing to take it. Show me that one case. And then people, believe that. So these are all myths. So I think if you stick to what your doctor says, believe in your doctor, and then do your own homework, we can definitely prevent the complications.
But among those complications, diabetic foot, does it affect the lifespan, Dr. Dharmalingam? I mean, how much of these complications would affect my lifespan?
See, all the complications affect the lifespan. More than affecting lifespan, I feel they affect your quality of life. Who wants to live a long life when you not comfortable and you're not having a good quality? So today, all physicians talk about quality of life. Your quality of life should be very good. And diabetic foot is one of the most preventable problems. It is the commonest, rather 20% of hospitalization may be because of the diabetic foot, but it is a preventable problem. All you need to do is take care of your foot. We always tell all our patients, take care of your foot as a woman takes care of her face. So see that it is moisturized well, there are no cracks, no injuries. And yes, the causes of it is because of sensation and blood flow. Because of lack of sensation, there would be a small ulcer. If you walk on some, in India especially, many people go to temples and they would not wear any socks or anything, and they get burns or boils. And this could lead to ulcers. And if they neglect it at that stage, and nahi theek ho jayega, it's okay, it will go. And then they will find that it becomes a non-healing ulcer, and it may even end up with a removal of what we call an amputation. So it's very important that we take care of our foot, especially if you're a diabetic, because of these problems. Look at the skins and see that there is no injury to the foot. Our old-time practice that the children used to touch the parents' feet is very important, in that indirectly they will look at the foot and see if there is any injury to that. So that is an important aspect, I feel. Yes, it affects not only your lifespan, also your quality of life. You have a negative impact of perception. And if one foot is damaged, the other foot is also likely to get damaged because of pressure inequality between the 2 feet. So it's one problem is going to lead to the other. And always we remember the feet is something we can see easily. And that vessel is reflective of the vessel in our body, like even the heart. So that's what is the peripheral vascular disease that Dr. Mohan and Amrish were talking about, where you have the disease in the feet, and that can actually be a reflection of what is in the heart. We have easy measurable ones. You can easily look at the feet, even if you don't have some gadgets. A physician can palpate the vessels and understand if the blood flow is good, if the sensation is good. But yes, it's the onus is on the patient to see that they take care and prevent amputation, and also any kind of physical limitations and functional disability is avoided.
You know, this is at the end of the day, I think there is a growing desire among people for an improvement in quality of life, particularly those as you scale the social ladder, people increasingly talk of quality of life. Dr. Mittal, presumably there's a direct connection between my ability to control and prevent diabetes and improving the quality of my life. Am I correct? How does controlling, preventing diabetes really improve the quality of the life that I can lead?
Absolutely right, Rajdeep. There is no doubt that controlling diabetes well and doing your ABCD well will reduce the risk of complications of diabetes. And it is the complications of diabetes that we were referring to just now that really compromise our quality of life. To be honest, if one is willing to follow just a healthy lifestyle and not get into that psychologically restricted frame of mind, then without complications, the quality of life and somebody with diabetes is the same as someone without diabetes, because all they're supposed to do is follow a healthy lifestyle. Maybe the person with diabetes has to pop in a couple of pills or do a few additional tests, but it doesn't majorly impact his quality or her quality of life. But the fact is that the moment complications start setting in, it becomes a challenge. Whether it's neuropathy, simple neuropathy, which is such a common complication of diabetes, the nerve sensation that you get, that tingling sensation, followed by burning and pain, and sometimes progressing to very, very severe pain, which will not let a person sleep all night. And the treatments for symptoms of, say, nerves are there, and they are much better than what they used to be, but they're far from satisfactory. So if you ask me, the single most devastating complication of diabetes in terms of symptoms is neuropathy, the foot complication. You could, if you start entering the domain of kidney problems, and then you start going down that track of all those restrictions, and then ultimately reaching dialysis. Oh my God. So that's another, although having said that, one must say dialysis in this country has really improved, and quality of life of people, even on dialysis, is much better than what it was. But still, from as compared to someone who doesn't have to go for dialysis, this is a much poorer quality of life. Similarly, look at stroke, for example. I mean, what happens if you get a stroke? What's quality of life? We are in a mess. So what I'm saying is that quality of life issues, are there in diabetes with complications. In diabetes without complications, there should be no major quality of life issues if you're not resisting the change to a healthier lifestyle and proper diet and regular exercise. It really should not impact your quality of life. And as Dr. Mohan mentioned, and I think Mala also mentioned, it's important to understand again that this low feeling that comes on to people when they have to live with a chronic disease, that should not be overlooked. And as physicians, it's our job to make sure our patients look at things positively, cheer up, and don't get bogged down, because that alone can take away all the advantages that you try to bring to your patient with proper medication and treatment. So yes, quality of
Mhm.
life is very important and is directly impacted by complications.
In this final segment, before we take a few audience questions, and there are lots coming in, is the whole notion of care for patients. Dr. Mohan, you've been mentioning the importance of taking your medications regularly, of the ABCD that you keep talking about. But how do you motivate patients, to take the medications, to ensure regular follow-ups, to ensure self-monitoring? Is there something, does one need to be self-motivated, or does the external environment need to motivate you, Dr. Mohan?
Ajib, it's very difficult. It's not an easy thing, but having said that, we can do it because it's a lifelong disorder. And as Amrish mentioned earlier, you're giving this to people who may not even have symptoms. See, once they have a burning neuropathy, which Amrish mentioned, they're willing to take any medicines. Although when you take those medicines, they'll make you feel dull. Your brain is, not functioning properly. A lot of side effects also due to all these medicines. But at that time, they're ready to take. Or if the kidney is damaged, now if you tell them, no, you have to take 10 more medicines, only then you can prevent dialysis, they're ready to take. But when everything is fine, now you tell them you take, why should I take it? I feel perfectly all right. They think it's like a fever, When you don't have fever, why should I take paracetamol? This is not like that. This is internally damage is going on. So I think it's education, and more education. The more we educate our people, show them some pictures, those things work. So we show them a picture and say, this is a normal eye, look at his eye with a bleed. See what happens. Oh my God, that's scary. Then show them some foot pictures. Say, see if you control well, your feet can be like this. Otherwise, look at this foot. You know how it is. So I never thought of that. Okay. So it's not frightening, but it's actually the truth. We don't want, or sometimes, in a resistant patient, I just take them on a ward round. I say, just come with me. I'll show you in the ward round. There you'll find somebody's leg cut off. And then you say, doc, I'll take all the medicines, I don't want to end up like that. I said, okay, this is what we are trying to prevent. We are not trying, overselling anything to you. We're just telling in your own interest. So I think it's education.
Education being critical. The role of the family, Dr. Mittal, also critical. Presumably, people around you also motivating you or in some way guiding you.
Absolutely, and I briefly mentioned that, but you're absolutely right. Role of family is critical, even more in India, because we are very sort of family oriented in that sense. So as I said, the lifestyle changes should be implemented for the whole family. The family has to be supportive and not accusatory, and not sort of pulling down the person who is affected with any chronic disease like diabetes. They need to be in it together, because they could get affected tomorrow. Plus, if the whole environment, we call our present environment an diabetogenic environment or an obesogenic environment. The environment is such, there's food that you order in offices, at homes, etc., eating from outside, eating the wrong kind of food. The whole environment is like that. Where are the healthy choices for people? And the environment encourages that kind of lifestyle, and no one looks down on it. So therefore, when the environment gives you those stimuli all the time, including the family, you will fall for it. So it's important. The role of family has to be supportive. It cannot be accusatory. It cannot be sort of putting someone in a corner, and saying, well, you got to do this now. We are all going to have ice cream. You sit in a corner, not have ice cream. That kind of thing.
In a way, therefore, we are talking about sort of increasing awareness. I think that one of the reasons, presumably also for the conclave, is to find ways of increasing patient awareness. Dr. Dharmalingam, I'm presuming that's critical for improving patient care. Unless you make people aware of what they need to do, how is the quality of care going to improve in the first instance?
Yes, very important question, Rajdeep. And I will just take off from where Dr. Amrish left, because family support means encouraging the person to take medicines, not telling the doctor, please don't start insulin. I always say, okay, you stop insulin now, you want dialysis later. Then they understand. So there are a lot of impediments that the family puts, and they would come on a festival, they go, take little sweet, nothing will happen. So this is the family support we want, that they should not tell the patient to eat something which he should not, which he doesn't also want to take, but they sort of force him because they feel guilty, I think, eating it without him or her. They may feel guilty, so they want that diabetic patient also to eat, which he shouldn't. So coming back to awareness, I was taught that education is the fourth rung of management. Diet, exercise, medication, and education is very important. A person spends 10 to 15 minutes with me. I don't need to have the knowledge of diabetes. He needs to know, what should I do? Now that I'm diabetic, what should I do? I don't want complications. So he should understand the importance of diet, importance of exercise, what should my control be, how should I make it control, how often should I test. So these things are very important. I want to travel to America, I have insulin. How should I carry my insulin? Simple things. How should I take my insulin? Where should I take? Even now, I get people taking insulin all the wrong ways, in the wrong places, in spite of so much awareness. So it's very important that we should have awareness. And I'll take this program, this opportunity, because I'm sure with you and Dr. Mohan and Amrish there, there'll be so many followers watching this. And many times when we have this education programs, they don't want to come. We have to entice them. I'll do free sugar, I'll give you free tea, please come. Then only they want to come. Or even then they don't want to come, because now that doesn't seem to be important at all, because they all have their glucometers. Education is important, but they don't want to come. And I want to encourage people to come for these programs, to listen and understand and spread this awareness, and all the myths that are associated, they also need to go. So myths of diet, for instance, rice you should not eat, something you should not eat, all these are just myths. So there are a lot of education that needs to go. They rather listen to their neighbor than really know what is the science. So I think it's very important that awareness should increase about diabetes. And of course, then we think of a vision of a complication-free India is very much possible.
You know, Dr. Mohan, you've got a forthcoming book, Making Excellence a Habit. Is there a core message that you want to share today that perhaps almost as an advanced preview of the book for patients and doctors, a core message that comes through?
Thank you, Rajdeep. I thought I'll just show you the book. This is the first.
Ah, that's very nice.
It's just come out.
Nice.
It's called
Nice.
Making Excellence a Habit, and the subtitle is The Secret to Building a World-Class Healthcare System in India. But it's not really just about building world-class institution and all that. It's all about what I have studied, things what we have discussed today. Why do people do what they're doing? Why are some people motivated? The power of positive thinking, for example, comes out very strongly in this book. So saying that, there are patients who come to me and they'll say, I'm going to get kidney problem. He's decided he's going to get it, So whatever you do, he's decided he's going to get it. And I'm actually talking about true instances about how within 1 or 2 years he develops a kidney problem, just as he said he would. And then there are others who have tried the opposite and said, you are not going to get kidney problem. Let's say this mantra 10 times a day. You're not going to get it. And true enough, reversal occurs. Somewhere, some positive thinking. That's why I mentioned that apart from everything else, stress, yoga, meditation, positive thinking. So that's one of the things that, as far as healing is concerned, that there are things beyond us. We give a tablet to somebody it works very well, to somebody it doesn't work very well. Of course, there could be biological differences, but there are also, the brain is very well connected to all the organs, and we keep telling the body, this will work, this will work, this will work. Somehow that seems to improve the immunology, and we've seen this during COVID, and we've seen this during other things. So that's one of the core messages. Of course, apart from saying how, I built everything from scratch, and those kind of things are also, this is actually not just for doctors, but for students and for anybody to have a lot of things about case studies where, people have achieved everything in life, from winning Olympic gold medals, and all that is there in the book. Thank you for asking.
We've gone on well over an hour. We've got about 10-15 minutes and a lot of audience questions coming in. So I'm going to ask you all for short answers so that we can try and take as much of these questions. Dr. Mittal, why don't you start? Because one of the questions is, diabetes is reversible or not? Can you please guide? Someone is asking that, is there a way in which I will be completely diabetic free after having got it if I follow the right path?
Yes and no. So the thing is, diabetes is reversible in some people. It depends on how far advanced you are in diabetes. If you're within the first 5 years, reversibility is not uncommon. If you control it very well from day one, reversibility is known. If you got diabetes largely because of your weight and bad lifestyle, if you reverse all those, if you lose 10 kilograms, 15 kilograms of weight, it's been shown very clearly in large studies, especially in the UK and in our country, that you can actually reverse diabetes. But you cannot say that for sure. So some people can reverse it, some cannot. The goal should be to have very good quality diabetes control, good quality of life, and maybe in the process, you can even reverse it. But the keys are early stage of disease, weight management, and very quick, tight control from the beginning of diabetes.
I wish some of you sent your names in when you're asking these questions. It would be nice to read out your names, but lots of questions coming in. Dr. Mala Dharmalingam, someone wants to ask you, can an increased psychological stress increase risk of diabetes? I think it's been mentioned during the discussion that, you need to control stress. Therefore, is that a major risk?
Yes, definitely stress is one of the most important risk factors. And as we were delving on that, the IT individuals and people working in call centers, of course, the day-night cycle also has. So stress plays a very important role in most of these non-communicable disorders, and especially diabetes. So that is where it was all coming, where Mohan was continuously saying stress control. This is not a prescription I can give. I can give for everything else, A, B, C, D, I can give. But for stress, I cannot, because many people don't even know that they are stressed. So I think a little bit of pranayama, meditation, doing something which makes you happy, at least for 1 hour a day. It's your life. It's you need to make it your time. This is very important, especially women out there. They are either cooking or they're cleaning or they're doing something, but they don't make time for themselves to be happy. I think to be happy is very important. At least a part of that 1 hour, half an hour, 1 hour, you should be happy. And it's your time. And of course, pranayama and meditation goes a long way in keeping your mental health good and stress controlled.
The interesting word used by someone who sent in a question, would I be right in saying diabetes is a silent killer, Dr. Mohan?
Of course it is, literally also, because, somebody can have a heart attack and not even know about it, because if the nerves of the chest are affected, if the autonomic neuropathy, somebody can have a severe heart attack and literally die without even knowing about it. But the other point is that the symptoms of diabetes come very late. So if you're waiting for all the classic symptoms you read about in the book, like drinking more water, going to the toilet, feeling tired and all that, you lose 5-10 years. So that's the time when the seeds for developing the complications are sown. And therefore, yes, it is very true that it's a silent killer. But having said that, especially in families where there is diabetes, you can start screening very early and picking it up. And that's where the annual checkup that you asked about is very important. If every year you're going for a checkup, you'll pick it up. And then if you control it and then follow all the rules, I think it's no longer going to be a silent killer and can be used to your advantage. It's like a tiger. You keep the tiger out of the cage, it's going to bite you. But to keep the tiger inside, you can go to the zoo and say hi to the tiger and all, nothing happens.
A lot of people asking questions about the use of vitamin D. And I think, Dr. Mittal, you're seen as the expert on this. Why don't you respond to that? How important is vitamin D for diabetes patients?
This is one of those areas which is constantly discussed and debated. Vitamin D is important for all of us. We all need vitamin D for our bone health, for preventing osteoporosis, for our muscle strength. So an optimum level of vitamin D, which means in the common lab test, 20 nanograms per ml is what we should aim for. If you're not doing a lab test, taking vitamin D between 1,000 to 2,000 units a day and not astronomical doses, as some people do, is very safe. Why is it important? It's primarily important for our bones and muscle. It may have a beneficial effect in diabetes. In particular, there's some data now again coming in that in conversion from pre-diabetes to diabetes, if someone is vitamin D deficient, the risk is higher. But I would say, regardless of diabetes, everyone should have an optimum vitamin D status, and not just for the diabetes part of it.
Right. Interesting. Another question that's coming in at the moment. Again, why don't you take this, Dr. Mittal? Are sugar substitutes like sugar-free safe? Any comment on jaggery?
So sugar substitutes are by and large safe. I mean, there is no convincing evidence, clinching evidence in any scientific journal showing that they are unsafe, and more data is available. And most organizations which deal with diabetes worldwide say they are okay with their use. We're not recommending their use, but if someone has a sweet tooth, needs some amount of sugar substitute, it's okay to do that. So we should not, as I think Dr. Mohan mentioned, there's the story of cancer and all is overplayed. Jaggery is, in terms of calories, the same as sugar. So all this thing about jaggery being said, jaggery may have iron, it may have other stuff which is good, but as far as the diabetes part of it goes, it's the same. So it's not superior to sugar, not for diabetes for sure.
Dr. Dharmalingam, why don't you take this question from Satish Namala, who says, hello doctor, I have I have type 2 diabetes for the last 15 years. I was on metformin 500 mg twice daily for the last 10 years. Recently, my GP said taking metformin is affecting my kidney function. GP has prescribed me for for 6 year 10 mg instead of metformin. I was reading some literature on for 6 year, and it says one of the side effects is reduced kidney function. I am confused.
Oh
Can you
God.
please advise? They are
Oh
asking
God.
advice now. Now it's
Oh
becoming.
God.
Dr. Dharmendra, you want to respond?
Yes, no,
It's a
there
good
is no
chance, yeah.
truth. There is no truth in the fact that metformin causes kidney disease, but there is always a cutoff below which you can't use a particular oral medication, and we call that as a GFR, glomerular filtration rate. So if your glomerular filtration rate is below 30, then you can't use metformin, and if it is below 45 to 30, you may have to halve the dose. But otherwise, in all guidelines globally, in US or in UK or India also, the first drug of choice is always metformin because it works on insulin resistance. The other drug that he was talking is a dapagliflozin, which is also a very good drug. And there is again no truth that that causes kidney disease either. In fact, now recently they have used it for kidney disease
Correct.
and found to be beneficial. So I think he has to trust his doctor, and of course he has to get the information. I mean, information is all very important, but good information from sources that are very authentic.
Uh, a generic question being asked, Dr. Mohan, is what are the various complications that increase the risk of COVID-19 in patients with diabetes? Important because there's been so much of talk of comorbidities. We've seen it, and doctors have been speaking about it. Why don't you respond to this? Because I think this is a question that I'm sure will a lot of people will want to know. Is the risk of COVID-19 much greater in patients with diabetes?
So thank you, Rajit. So the opinion, I mean, if you, I always used to say that COVID is spread by a droplet infection or by coughing or sneezing. So if a person with diabetes is staying at home in a room like this and not at all exposed, his risk or her risk is not higher. Having said that, however, if the COVID-19 gets into the body, definitely if the sugar is not controlled, if your A1C is high, if your blood sugar is not controlled, it spreads like wildfire. It produces a lot of damage in your body. It can lead to morbidity and even mortality. So if you look at the people who have not done well after COVID, look at the deaths, diabetes comes quite high in the prevalence of the conditions, comorbidities. Diabetes will come probably number one, obesity, hypertension. So suppose you are obese and you have hypertension and you have diabetes and you have little heart disease and you have little asthma to boot and you're a little older, your risk keeps mounting for all these risk factors. So the best thing is to prevent COVID by wearing the mask, which Amrish talked about, and taking all the other precautions. And if you have diabetes, keep your diabetes under good control. If you have diabetes really under good control, thousands of my patients have got COVID, and almost all of them have recovered, except the occasional patient whom we have lost. They've all done well because they're keeping their diabetes under good control. So the death rates have not been all that high. So I've not lost too many patients due to COVID, although thousands of my patients have by now developed COVID. That's because that's the power of good control of diabetes. So that's my message to them.
Dr. Mittal, Mohammad Arif as a follow-up asks, will the COVID vaccine have any adverse effects if you're a diabetic?
No, I think that's a good question that is asked now for the last few weeks every day in the clinic. The outpatients is no. The COVID vaccines are actually ideally suited for people with diabetes because that's where they are required. Those people are at higher risk for poor outcomes. And if you're not going to vaccinate people with diabetes, who are going to vaccinate? I think people with diabetes, there are specific contraindications, allergies, those are listed, but by and large, no, people with diabetes will not be the worse off. They'll definitely be better off by taking the vaccine.
Well, that's reassuring then. Again, a question from Prem Kumar, ma'am, and Dr. Dharmendra, why did you take this? What is the safest sugar substitute? And he's also asking, are there side effects of taking statins for a long time? Why don't you take the statin question first and then the sugar question?
So whenever a drug is given, it's always the risk and benefit ratio. So if the benefit is, if with the statin, the benefit is so much higher that the risk is almost negligent. So what is the risk? The risk very commonly is muscle pain. There may be some muscle cramps and muscle pains, little common side effect. The other side effect that people do talk about is that there may be a small risk, 8 to 9% risk of new onset of diabetes. If you're prone, you may become diabetic in a small segment of people. And again, a small percent of people who have little bit of kidney abnormality should be a little careful in what of the like interstitial nephritis, we call it. So these are some of the side effects, but by and large, nothing. It's very safe, and he should be taking the statins. The other question was
was on sugar substitutes, ma'am.
Sugar substitutes, like both my panelists have said, that they are very safe, and largely there is aspartame and there is stevia. I think both of them are good, and they can opt for any one of them, which is safe, and one is plant-based, which is the stevia, right, and it's safe and they can use.
And Venkat, a lot of people asking, effectively, this has turned into effectively a patients coming to their doctors for prescriptions. Venkat Natarajan wants to know, no clarity on what fruit a diabetic can take. Please throw light. You again want to take that, Dr. Dharmalingam? Is there any specific fruit?
We encourage fruits. Fruits should be taken. There is no fruit that we say don't take. But there are some fruits which have high glycemic index. So for that, we say take a little less, like mango, for instance, or custard apple, sapota, or jackfruit. These are the 4 fruits we take in moderation. But otherwise, all fruits have got good mineral vitamin content and good fiber content, which all are important. So at least 1 or 2 helpings of fruit a day is a must.
We're getting even questions today from Cambodia. And, it's quite remarkable that you're getting questions from all over the country. Someone, Tehseen Chako, Dr. Mittal, wants to know, can you throw some light on diabetes and oral health, teeth, gums?
Yes, I think that's a good point. And in fact, oral health issues are far commoner in diabetes than they are in people without diabetes. In fact, periodontitis, that is inflammation around the teeth, has been shown to be a marker of complications of diabetes also. People who have a lot of oral problems are also the ones who get heart problems and others. So I think oral, and that's undoubtedly one of the neglected areas in diabetes, even in our country, even in the best practices, often dental hygiene and dental care is neglected. So there is a lot of connection, and it should be addressed, and a regular oral examination is very, very important.
The question from Cambodia, from someone who says he's called Banso Cheat, says that, is there a specific vaccine you would recommend for if I'm a diabetic, Dr. Mohan?
I don't think for a diabetic person with diabetes, a specific vaccine has been recommended, because they all work on different principles. So depending on which vaccine, for example, in our country, as of now, we have only 2. We have the Covishield and we have the Covaxin. So the Pfizer and the Moderna, which are used extensively in the UK and US, are not even available in our country because they have cold storage problem. They have to have -70, -80, and I don't think they're even going to come to our country. So it's not a question of which vaccine, but whatever is available in your country. And for people with diabetes, it really doesn't matter that only this particular vaccine is wanted for people with diabetes.
I'm going to very quickly, and I just have a couple of Dr. Dharmalingam, Sandeep Sharma asks, is taking curcumin or turmeric milk, is taking turmeric milk at night recommended?
See, if he's taking turmeric milk, there is no harm at all. So he can continue to take, I think it's been widely advertised, gold milk and all that. So yes, turmeric has its uses, taken in the correct proportion and in ways for other benefits it has. So there's no harm. But if it's going to reduce sugar, I don't know.
Let me ask you all, therefore, in conclusion, a question that has been asked, a rather emotional question. Can people with diabetes still have a family, career, and a full life? The final question, Dr. Mittal, Dr. Mohan, why don't you take you first, Dr. Mittal? Can you say that patients with diabetes will have a full life, career, nothing to worry about?
Absolutely. And I think that is a single most important message of today's conclave should be that people with diabetes can have a completely normal, healthy family life, pursue their careers to the peak. And if one were to name, then people who lead the world, most of them are have diabetes. Okay, all your senior politicians who lead everything, they actually have diabetes. If that's proof required, so you can have cricketers. You can have a perfectly normal, professional, personal, high quality life, even if you have diabetes. It doesn't matter.
Right. And Dr. Mohan, why don't you conclude on that note? I
Yeah.
mean, since
So
that's been the theme of this conclave,
yeah,
why
and
don't you give that
also
sense of?
not the theme of my book. And so in my book, I talk about three people. Wasim Akram was a Pakistan captain who had type 1 diabetes, was taking insulin. Gary Hall, the Olympic swimmer who won in two separate Olympics. After he got type 1 diabetes, he got gold medals. And then I talk about Nicole Johnson, who became Miss America, wearing an insulin pump when she went for the contest, showing that pump, she still was declared Miss America. So there you have a beauty queen, you have an Olympic gold champion, gold medal champion, and you have a Pakistan cricketer, a captain of the Pakistan. So what more? I mean, you can achieve anything in life. I don't think diabetes, and these are all type 1.
Right.
Type 2 is much simpler. So.
Just a final question. Someone wants to know, Shafi wants to know, Dharmalingam, whether a fruit juice is safe for diabetes. I mean, you're going to have a full diabetes. But she's insisting, Shafi is insisting that I ask this to you.
Yes, fruit juice she can take, but we encourage the whole fruit because it has its own benefits of fiber intake. So the sugars won't go very high. Though sometimes if you take direct fruit juice, it may just step up your sugars a little bit. But yes, once in a way, nothing is forbidden. And we're all
fruit better than fruit juice.
Yes, fruit better than fruit juice.
Okay, we could go on and on. There have been lots of questions, but I think it just shows the level of concern that people have. And it also reflects, in a way, the importance that people are increasingly attaching to health and a healthy lifestyle. And I think all three of you doctors have done wonderfully well in answering these questions and giving us a sense of a positive outlook to life while also sending out messages of caution. So thank you all very much. It's been for me also an education. And I'm going to be very careful about my cholesterol, the C and the ABCD. But thank you, Dr. Mohan, Dr. Ranbir, Dr. Mittal. It's been a pleasure talking to you this morning. I just leave it now to the organizers for a vote of thanks.
Thank you.
Thank you. Thank you.
Yeah, I think it was a great conclave. And there are so much of experience the experts have got. I think they have seen lakhs of patients. So one word I can call it that their tapasya in the field of diabetes has really came out with a lot of mantras. There's a lot of talk about lifestyle change and exercise and diet Dr. Mala has given us. Dr. Mohan has talked about ABCD mantra, which is a very, very important for the all diabetic as well as non-diabetic people. Dr. Amrish Mittal has emphasized upon taking regular medications, keeping everybody aware about diabetes, doing regular checkups, and then we can prevent complications. So I think every diabetes has a right to live up to 100 years. So there is no doubt about that. So I thanks all the three expert panelists. The another important point is that we have got 8 crores diabetes and there are 4 crores pre-diabetic people, and there are a lot of undiagnosed people also, and a lot of people developing heart attack and stroke. So it is very important is that this big national platform, this topic has to be taken. And I really thanks Rajdeep Sardesai. The reason is that whenever he takes any issue, the whole world listens to that carefully. So I think this diabetes, once it is taken at such a large platform by Rajdeep, it will definitely get a great awareness and a lot of people will benefit in their life. I thank our association along with SIMA because they have got a great the team and they have encouraged us to participate in this particular program. Our whole USB team, especially digital team, our Sachin and Srikanth. And the most important thing is all the viewers, because after the COVID, we have realized that health is our fourth need now, right? So it is very important is that, and the new concept which is coming up as glucose as a fifth vital sign. And after temperature, pulse, respiration, and blood pressure, the glucose is the fifth vital sign, which is very, very important. So all the viewers who have attended, and as well as they are going to view this broadcast in the later on also, all will be benefited because of the experts which are gathered. I request President SIMA, Shabin Sarvottam, to give a vote of thanks. Thank you.
Thank you. I'll just correct myself. It's SIMA.
Yeah.
So, Vanakkam from Chennai. And first and foremost, it's mind-boggling figures in front of me, because just with Mr. Rajiv Sardesai talking about the number, what was initially told to us all, that India stands second in the world. Now that's some sort of a worry for all of us, but I think the doctors have given us something to be assured of and what we need to do. Now, eating habits and other habits, as other doctors have been talking about, education is another point which everybody is talking about. Now, these two things, if you start emphasizing on, I think it makes a big difference. Right? We're all worried about our mobile phones and cars, but we're never worried about ourself, that is our body. And as all the doctors have said, that we need to keep checking ourselves on and off at certain times, at the time when it's really required, and not go at the last moment and be worried about coming to a big scare for ourselves. Thank you, Mr. Rajiv Sardesai, for that lovely introduction, and for moderating the entire show. It has been an absolute wonderful listening to you and even moderating the whole thing. Dr. V. Mohan, for showcasing that book of yours and for even talking so many good points in giving us that learned insight into everything. Dr. Amrish, for having given us all the inputs of what to follow and what not to follow. That's something great. And most of all, Dr. Mala Dharmalingam, that please make it a habit of not only sitting down, but going around. Yes, I mean, emphasizing yourself into exercising or even just walk around. I mean, that's something great that you've told us, that, brisk walking is the best medicine for you to be coming out like. I'd like to thank the main sponsor of this event, USV, and the entire team of USV for having, come along with the SIMA team, the entire members of SIMA for being part of this entire conclave and putting across everything so perfectly. I'd like to thank Mr. Shankar, who's here giving us the entire backup in terms of the platform. Ms. Kanchana of Sprinkle PR and the media personals who have helped us to, put it across to the entire, fraternity of the diabetics following thing. And last but not the least, I think sedentary style should not be your goal. You should be as active as possible. Non-awareness is nothing, not a really good point. You should be aware of what you're thing. And end of it all, I would say happiness brings in the best of you. So thank you once more to everybody, and thank you all.
Thank you.
Thank you. Bye-bye.
Thank you, everybody. Bye-bye. Thank you.
Bye-bye. Thank you.